Thank you for joining us on this call. My name is Brian Marvel. I'm president of PORAC. Before we start this, I'd like to have a little disclaimer. This call is being recorded, and we'll make sure to send out a link after the event for your future reference. Joining me today is Damon Kurtz, Vice President of PORAC, and the Region 4 representatives, Tony Bolanos from Ontario POA, and Brian Avera with the San Diego POA. Your time is incredibly valuable, and even more so during this crisis, so I definitely want to thank you again for taking the time out to be on this call. As we mentioned in the email invitation that went out, we're going to begin with a brief update before we get into the question and answer phase of today's meeting. Before we take any questions, if you're using the Zoom app, you can click the raise hand icon on the bottom left of the Zoom window. You'll also be able to see the hand icon turn green. That way it'll help me identify people that have questions. Let me begin by saying we're faced with an unprecedented challenge, and our law enforcement community wants you to know we are your partners in addressing this challenge and containing the COVID-19. Law enforcement agencies throughout California have deployed teams of officers to go above and beyond their call of duty to aid their communities during this crisis. We're helping to deliver meals to seniors and at-risk youth. We've assigned officers to grocery stores and new emergency shelters to ensure people feel secure. Some of our law enforcement agencies have moved to longer shift, canceled training and vacation time to make sure that our staffing is appropriate to meet the needs of our communities. Peace officers support all first responder calls, and I think this is important. You have to recognize when somebody calls 911 and reports a fire and a medical emergency request or a welfare check. I would say by and far, peace officers respond to those calls, and usually we're the first ones on scene. While there's a heightened need for officers across California, we've had a number of law enforcement officers test positive for COVID-19 and many more who have called in sick due to the symptoms of COVID-19, but who have not been tested. Along with our doctors, nurses, and food providers, our officers play an essential role in responding to this crisis, and we too are feeling the strain on our resources. Our objective today is to provide you with a brief overview of the resources we need to ensure we can continue to proudly serve our communities during this difficult time. As you know, preventing the spread of COVID-19 is the primary objective of this nation, and it's ours as well. Essential personnel must continue to show up for work, are at greater risk both of contracting and spreading the virus. To keep our officers and those we serve safe during this pandemic and to help contain it, we are in urgent need of additional personal protective equipment, which you've probably heard as PPE. Right now, we have officers in the field that either have no masks or only one. Officers are having to choose between wearing their mask or offering it to an individual they're interacting with. Our officers are running low on disinfectant that is needed to properly clean their vehicles and equipment between calls. I recently came in possession of a national law enforcement report. Law enforcement, which includes jail facilities and court security, will need approximately 11 million N95 masks, 11 million disposable gowns, 11 million eye protections, 23 million gloves, and almost 2,300 gallons of disinfectant. One of our second priority is testing. We're trying to secure expedited testing sites for first responders showing symptoms or who have encountered an infected individual. We recognize that we have limited tests available across the nation and within our state. However, our law enforcement officers come in contact with some of the most at-risk citizens on a daily basis, the homeless and elderly. We cannot keep these populations safe if our officers are unknowingly carrying or transmitting the COVID-19. I recently read reports where people can be asymptomatic with the COVID-19 virus, which puts more people in jeopardy if our own officers don't even know they have it. Seen in Seattle and Chicago about first responder only test sites. Sadly, in Chicago, when they opened it, they ran out of their test kits within 4 hours. Seattle's had the greatest success to date, and they were the first. California must establish designated COVID-19 testing sites for first responders throughout the state. Been told to me via the governor and our website that was created by the state, there are 22 health labs with testing capabilities. Recognizing that it will take time to establish these sites, high-risk regions with the greatest number of confirmed COVID-19 cases should be prioritized first. Third, in more of a midterm priority, is to establish COVID-19 as a presumptive occupational illness to be covered under workers' compensation. As peace officers and first responders are essential personnel, they are exempt from California's shelter at-home order and are significantly at higher risk for contracting the virus in the course of their duties. Should any officer or first responder contract the virus while performing their duties, we believe this qualifies as a work-related illness that should be covered by workers' compensation. With that said, we are currently working with the governor's office and the pro tem's office to draft language and have it reviewed to either do it via an urgency legislation or through an executive order. With the testing, we want to make sure that we have a quarantine space for our officers who test positive or need to be quarantined to determine whether they have the virus or not. As officers are risking their health and safety in the course of performing their duties, we must make sure that they have a safe place to go if they do come down with the virus or need to be quarantined. The governor is currently providing homeless individuals exhibiting the symptoms of COVID-19 with the purchase of hotels. We looked into the hotel occupancy rates, and it shows that they're hovering around 10% statewide. We believe similar arrangements can and should be made for peace officers serving our communities, especially those that have families. One of a longer-term priority is vaccinations. As I mentioned, keeping our community safe requires that we also keep our officers safe. We recognize that a vaccine is being worked on, and hopefully one will be out very soon. And when it does, we want to make sure that our public safety first responders are on the priority for receiving it, or if there becomes a medical protocol that mitigates the effect of COVID-19, we want to make sure that we're on the priority list for that one too. So in closing, I want to emphasize that our officers are ready to do everything in their power to support our communities during this crisis, but they also need your support as they rise to meet this moment. We're asking our state and federal elected officials to introduce urgency legislation and support an executive order by the governor to help ensure our officers have the resources they need to show up for our communities during this crisis. While an executive order may preclude the need for urgency legislation, we're asking that our elected representatives pursue both courses until we have a viable path forward to getting our officers the resources they need. Now I would like to turn it over to our region representatives.
Just not having the proper amount of PPE. As far as really those N95 masks, I know we're seeing it at the federal level of government where they're really trying to get these factories making up the N95 mask and more gloves. But we really are truly in desperate need of getting those masks down in San Diego, more of them. And test kits as well. The last thing I'll say, and I'll let Tony pick it up from here, really getting that space. Should we take the test and become positive? God forbid that happening if we start experiencing that down here in San Diego. But what do we do if we think that someone is presenting the symptoms or we're in a holding pattern and we've just taken the test? Where does that officer go? Do they go at home and at home where their family's at? We think it'd be more appropriate for them to have space, as Brian alluded to at the beginning of the conversation, to at least possibly have a hotel space too, as that's been allocated for others in the homeless population here in the San Diego region.
Thank you, Brian, for that. It looks like we have Tony back. Tony is from the inland chapter, the San Diego Imperial chapter, and I think he had a couple comments too.
Okay, you hear me now?
We do. We hear you great.
Okay, great. All right, yeah, I just got a report from a couple of agencies actually about half an hour ago. So there are a couple of agencies here in the Inland Chapter. Banning PD has no mask whatsoever. So absolutely, we should have a priority on getting this equipment. We're trying to scrounge up some masks for them for surrounding agencies, see if we get them some masks out there. There's other agencies, including ourselves. I'm from Ontario PD, where we don't have no wipes to wipe down our equipment, our units, or anything like that. So obviously we need that to be a priority for us too. And yes, next week will be the county will be coming to our city to start driving testing, but no word on if they're going to make law enforcement priority or first responders priority to come in. We hope that they do. I think we'll keep working with the county for that. Obviously, we're in the front lines and we come in contact for quite a bit, and officers are still coming into unnecessary contacts, I guess, with people that need to go to jail. And so we would like to get them, give them priority in testing. At this point, where the officer has to stay with their prisoner all the way through the process and take them to the county jail. We're not letting our civilian personnel do transports anymore in their vans. So it's the individual officer that has to go there. So obviously he's going to be more exposed to this virus. So yeah, we're just hoping to make it priority. I know I have Grant Ward online too. I know one of his deputies got infected and he's in quarantine. A couple of other officers in the Inland Empire have been infected, that they're on quarantine. A couple from Redlands, like the San Bernardino Sheriff, so one from Indio. So, Grant, I don't know if you have anything else to say.
Well, you know what, Tony, I'd like to add thank you to Brian and everyone, executive leaders at PORAC, for getting this going. I do have a little bit of light at the end of the tunnel, and I'm going to play it's about a 29-second clip from my deputy who tested positive for the coronavirus on Monday. This is him talking to us right now.
Hello, everyone. I know people are talking about how I have the coronavirus. I just wanted to let you know and reassure you that I'm doing great. It's been 5 days, and I'm currently symptom-free. But I still need to follow the CDC guidelines and quarantine myself for the 14 days. My family is here at home with me, taking care of me, and they're doing great as well. I would like to thank the department, SEBA, and my partners who have reached out to me and checking in to make sure I'm okay. I want to reassure you that I will be back out there working with you guys very soon, and I hope everybody stays safe.
So I know his particular case was excellent because his symptoms were mild from the onset. He was high fever and off and on cough, but was able to recover really quickly. My hope is that's how the majority is going to be. But the reality is his positive test created a panic at that one station. Of course, the San Bernardino County is the largest county in the United States of America, so I have a whole lot of members from state line Nevada all the way to Arizona, down into the border of Los Angeles. And every single one of them called me in a panic on Monday. And yeah, granted, it's 4,000 members. They didn't all call me, but I'd say about 100 of them called me from every single station, and they are absolutely worried. And we just don't have the test kits. We can't rule out that people are actually contaminated, whether or not they have it, because the test kits aren't even available. So that's a huge priority. We put out a briefing information the other day about how to create your own hand sanitizer, but what we're being told is it's not even available for weeks, if not months out, from commercial sanitizer. We need the help as soon as possible.
Well, thank you, Grant. I really appreciate that. I'm going to put you back on mute. I'm going to unmute it at this time for everybody else. If there's any specific questions or concerns from our elected officials or their staffers.
Hey, Brian, this is Tony again. I just want to make sure, see if we could, we get these tests in San Bernardino County, to see if we get a priority over, for law enforcement, for first responders to get tested. I think that's one thing we do need. I know in my agencies, we are starting to test officers as they come in and leave duty. They're taking their temperatures. So obviously, if somebody is with 100 degrees, they're being sent home. And we would like to give priority to those individuals testing, and obviously for the vaccine. Once we have the vaccine, priority for the for law enforcement or first responders.
Thanks, Tony. Do any of our elected officials?
Congressman Correa here.
Hi, Congressman. How are you doing?
Well, good. Under the circumstances, I just wanted to chime in and say it's an honor to work with PORAC, with our thin blue line here in California. I chair a committee in Homeland Security that deals with TSA frontliners, so to speak, and they have a very similar role as you've described in this call to police officers, which you're always touching people, handling people, really in the front line of strangers. And we're beginning to see what, how that danger manifests itself. A lot of TSA officers are now positive, and a lot of them have been quarantined. And I think the same will be, if not already, for police officers. So I would just say my office is ready to work with you to try to come up with a legislative package on the issue of presumptiveness here. On the other issue, in terms of equipment, that's a tougher one. I know everybody is scrambling from hospitals to TSA to peace officers to the hospital emergency room personnel to address this issue. But, today, tomorrow, maybe the next day, we're going to be voting on this $1 trillion package that's moved out of the Senate. We're still trying to work through the language and seeing what is there and what is not there. Not sure whether we're in time to make any tweaks to it. However, with that being said, there is talk already of a fourth package being proposed. And so I would invite you to sit down and try to figure out if there's any language we can put in that fourth package to address some of the issues that PORAC is now bringing up.
Thank you, Congressman. Our advocates at Steptoe and Johnson are on the line, and I'm sure they're taking notes, and we will be in contact.
Thank you very much. Go ahead.
This is Congresswoman Norma Torres. I'm trying to utilize my 911 dispatcher skills here, working on two different conference calls at the same time. I just wanted to take the opportunity to thank all of you for this update, and I hope that we can do this weekly so that we can update each other on what is actually happening on the ground. When I heard that there were some issues regarding budgets and holding up certain police departments' budgets were holding up ordering supplies while, other countries were getting ahead and ordering those critical supplies for you. I went ahead and placed a $10,000 order utilizing some campaign funds for hand wipes. Tony, it's about 2,000. I think it's a 2-month supply of wipes. I'll make those available to you, to the Ontario Police Department for you to send, across our most needed departments. I would just ask that you please don't forget about my Pomona guys here, as they have 2 hot zones in our home city of Pomona. The other thing, I just want to reassure everyone that every member of Congress is working really hard on your behalf, looking at these protective supplies that you desperately need. So don't think that you're alone out there. I'm so sorry that this is happening to you, but we are there with all of you. And I have to hang up. So if there's anything else, you guys know how to text me or call my office if you need anything.
I appreciate that, Congresswoman. Thank you for all the work you're doing for us.
Thank you, Norma, very much.
Thank you. All right. Any other questions from our elected officials?
Hi,
yes, this is Assembly. Go ahead. Who wants to go first?
Go ahead, Pat. That's Megan Daly. Go ahead.
Oh, hi, Megan. Yes, our Orange County State Legislative Delegation has a daily call with our Orange County Executive Group and the EOC. I just want to know if you have put your orders in for those PPEs through that process, and so that we can certainly advocate strongly for the receipt of those, because I believe I know in South Orange County, Quest Diagnostics has just increased the number that they are testing through the private lab. They have 2 different sites. So any information you could provide to us that we can put through our channels, I'd be, more than happy to, emphasize the needs that we're hearing on this call, because it's kind of new information in terms of the lack that's been there.
Absolutely. I will reach out to Edgar Hampton. He's my chapter president for Orange County, and I will follow up with him with that information. Is this a good number to reach you at? The 949?
Yes, it is.
Okay.
Yes, absolutely. Thank you, guys. We really thank you for all you're doing. Absolutely.
We thank you for everything you're doing for us.
Hi, this is Assemblywoman Megan Daly. Thank you for everything that you guys are doing. Also in the North State, do you guys have, do you know what's needed here as well? Is there a centralized place so we can find that out?
I've created a email address, covid19@porac.org. We are putting together a survey to send out to all 930 of our affiliates. We're going to be requesting specific details on what the needs are. When I compile that, I should have something available to you probably early midweek that will also disseminate amongst everybody that was invited to this call. And we're going to do this on a roving basis, so I'll be able to give you a weekly update of how many officers are affected, how many officers are in quarantine, how many officers have recovered, which is great to hear with Grant and Seba about his officer, and then also the equipment needs. And that way we can just have this nice free flow of information between us and your offices. And a lot of times, sometimes it's just a matter of knowing where the right place is to contact somebody to get the equipment.
Right. Okay. Well, I guess I could see that people in our communities would rally around, you know, in some of these more rural communities to get items to our law enforcement that they need. If I knew what the need was, I could be pushing that information out. So.
Yeah, that's great. And like when I talked earlier about the testing and the prioritizing it where there are the heavier virus rates, because, you know, like in Northern California, I'm not sure if it's all in your district, but I think the 3 counties that are on Oregon and Nevada, they don't even have a single case of the COVID-19. Right. So, you know, we want to make sure that we prioritize the areas that have the largest outbreak.
Right.
But I appreciate that. Thank you very much for the info. Anybody else have anything?
Hi, my boss, Assemblymember Borna Horvat, is having trouble unmuting herself. She wants to make a comment.
Okay, let's see. All right, let me try this one.
There we go.
Oh.
Hold on. There we go. Can you hear me?
I can hear you.
There you go. This is Tasha Borna Horvath, Assembly Member, 76 Assembly District. Thank you so much for all you do. Thank you so much for having this call to let us all know what the real issues are. I've, heard the issues about the testing and the PPEs from my local cities as well. Specifically, Vista and Oceanside have brought them up as a real concern. I'm happy to work with the San Diego delegation. I don't know if there's other members on the call to make sure that you're getting that, because I think that's really important that we keep our peace officers on the ground at this time, especially as the number of cases ramp up and people get antsy at home. So
absolutely,
whatever I can do. And I also appreciate the workers' comp issue. I think presuming that COVID-19 is a workers' comp issue, I think is really important. And I'm happy to have my office work with my colleagues to address that.
Thank you, Assemblywoman. And Brian Avera is on the call, and I believe he has your contact info. I'll have him reach out to you and see what we can do in that area. I see that Grant Ward. Go ahead, Grant. I'm sorry. Let's see. There you go.
All right. Thank you, Brian. Hey, I wanted to kind of give some information that can be passed on. One resource that we found here with San Bernardino County was to reach out to the local schools, which are, of course, all closed. But many of them have substantial stockpiles of masks, gloves, limited hand sanitizer, but still some of the masks and gloves they seem to have a lot of. So if you could relay that if the individual agencies haven't reached out to their local schools that are closed, that may be a good immediate assistance. It's certainly not a long-term fix, though.
Thank you, Grant. I believe Randy Perry wanted to say something.
Hey, Brian, thanks. And thanks for doing this. So I just wanted to clarify, we have given language to both the pro tem and the governor's office on the work comp presumption for C-19. Our language is obviously different for the governor because it would have to be executive order. So what we're hoping is that the governor would do an executive order. It wouldn't just be for peace officers, be for first responders and any other employees, whether they're hospital employees or whom that the governor would want to include. We are obviously completely okay with that. But also, that would only last as long as the executive order lasts. So what we were hoping, and the reason we're going to the governor as well is because we're just not sure when the legislature is going to go back in session. So we would probably are trying to do, and I know the Pro Tem's office is already meeting with Ledge Council on our language. I hope the governor would do a temporary EL, and then we could come back when the legislature does reconvene and statutorily perhaps put it into an urgency measure. I mean, we could put, a sunset on it if this is eventually going to go away. It doesn't need to be on the books, a year from now or something. We're okay with all of that. We just need to get something done quickly.
Thank you, Randy. I know we've hit our 30-minute mark. I'll take one more question.
I just wanted to say this is Claudia Lopez, District Director for State Senator Ben Hueso. For the San Diego delegation, please feel free to reach out to me or my chief directly, and happy to work on these issues alongside you.
Thank you. I appreciate that. And
This is Juan Hernandez with Congress and Scott Peters. Again, just want to thank you for your service. Was a law enforcement officer for 12 years and ended up working for the congressman. But I just had a couple of quick questions. Just wanted to confirm. So do you have numbers on state for police officers across the state that tested positive? Also numbers for San Diego? You don't have it? Do you have any of those numbers now?
I do not have the specific numbers for the entire state. Okay. Maybe Brian Vera can talk specifically about the city of San Diego.
Okay.
Brian, are you on the line?
I'm here. Can you guys hear me?
I can hear you, Brian.
Okay. So for the city of San Diego, at this point, within the last few hours, I've heard that we have 0 cases. Of course, anything could change. I know I'm hearing in the neighborhood about 15 that are in quarantine right now, though.
Okay. Thank you, Brian.
No test available. I know. Let me just add, I've talked to the county. There's only 120 tests available in the county of San Diego. That's what I was told. It's in a county of, what do we have here, 3.5 million or so still.
Right.
Okay. Juan, I'll try to get you those numbers in the next 48 hours.
Perfect. Thank you. And I just encourage you guys to continue this call. This is super helpful.
All right. Thank you. Did somebody else have one more question?
Hi, this is Matthew with Assembly Member Todd Gloria's office. Just wanted to say thank you to PORAC, all of the law enforcement officers involved. Teamwork makes the dream work. We're here for you, and thank you for all that you do on the front lines. Specifically, wanted to ask exactly that is, how often will these calls take place?
Honestly, we were only doing this first batch. I was going to try to talk to my team and see about doing another one after I've got the survey results, so we could put that information out to you. So when I get back with my team, we'll send out more information about future calls.
Thank you. This has been very helpful.
Thank you.
Thank you.
All right. I want to respect everybody's time, and I really appreciate all the elected leaders and their staff members to make this call. Thank you for everything that you're doing to not only support our first responders, but all our medical technicians who are doing amazing work every day with the people that are infected. We can't thank those folks enough, and I can't thank you for all the leadership you're doing for us at the state and the federal level. Please be safe and have a wonderful day. Thank you.
Thank you,
Thank
everyone.
you.
Thank you.
Appreciate it.
Thank you.
Thank you.